Thank you, Honorable Minister of Information, colleagues, members of the media that are here, adding our voices of condolences to you for the loss of your colleague. May God rest his soul in peace. From our side, the Federal Executive Council today extended its appreciation for the leadership of Mr. President in driving major transformation in Nigeria's health sector. We're seeing a revolution in terms of the infrastructure and equipment in the federal tertiary institutions across our country. The recently launched oncology centers in the teaching hospital in Katsina, in Enugu, and Benin are just an example of what this president has approved, has provided resources, and is already beginning to yield tangible results that Nigerians can see. That folks who are unfortunately facing the deadly disease of cancers may choose to use our own resources here in this country. Unless somebody chooses to do otherwise, the world-class infrastructure that this president has provided can be able to attend to most kinds of cancers. And those are accompanied with human resources. And beyond cancers, there are many other investments that this president has provided in federal health institutions so that Nigerians can have the relief that they are seeking for, in line with his renewed hope agenda and the health sector renewal investment initiative. And the approval by Federal Executive Council today of an additional oncology center at the University College Hospital in Ibadan is a continuation of this trend of revolutionizing the health infrastructure in our country. FEC approved the full business case for upgrade of the existing oncology center at University College Hospital in Ibadan to be upgraded, its infrastructure, to have linear accelerator to provide radiotherapy and many other diagnostic equipment in Ibadan so that we cater to the Nigerians who are suffering from this unfortunate disease, cancer. There are additional oncological centers in Lagos, in Zaria, in Jos that are in the pipeline, alongside many other massive projects. We also appreciated the role of the Minister of Finance, Ministers of Budget in Mr. President's team, because it was a team effort to deliver this vision of our President for Nigeria to begin to have world-class facilities all over our country. In addition to the largest hospital that we now have in our country in the West African region, and perhaps one of the largest in the continent, the University of Maiduguri Teaching Hospital, where this week more than 10 major projects were commissioned. A neurology center, a stroke center, a heart center, stroke center, and an interventional radiology center, and a revamped oncology center. So this is revolutionary. This country has never witnessed such kind of attention by a president to reboot the health system. So Council deliberated on that, and Mr. President encouraged us to continue to double down. And importantly, to appreciate all the health workers who are working diligently in federal facilities, state facilities, and in the front lines, despite difficulties that they encounter. In addition, Council appreciated the 2 years of relative peace, industrial harmony that we have enjoyed in the sector, and that we are intent to continue to work towards maintaining that peace and harmony. We acknowledged that a recent circular by the Salaries, Income and Wages Commission, which was based on a prior agreement, precipitated discontent among various health professional groups. And once those discontents were made public and by those associations, this is a listening government. The circulars were withdrawn, and now we're in the process of negotiating in a transparent manner the increment in allowances so that we meet those health workers on the needs that they have expressed. And we are currently also in active dialogue with the key professional associations, NMA, which had provided an ultimatum for the negotiation with its leadership, which was very constructive in its approach. I think extended that ultimatum while many of the outstanding issues have been looked into, including the outstanding arrears, for which the Minister of Finance is going to ensure that those are being defrayed over time. There are other issues for nurses, for instance, centralization of posting of interns. Those ones we've agreed that those will be done, managed centrally. That's the fair thing to do. There are other issues that are bordering on establishment issues. We're working hard to ensure that we meet them. Not all of those issues are financial in nature, but this government is committed to ensure that everyone is respected in the health sector and their needs are addressed to the best extent that is possible. And tomorrow we're having further discussions with leadership of those unions in the spirit of Mr. President's encouragement for us to ensure lasting peace, to resolve those issues to the extent possible. And we'll continue in that direction. We call on all health workers to put the Nigerian person at the center of our attention. There are issues that we can resolve through negotiation, and we are intent in good faith to continue to find ways to resolve those outstanding issues with them over time. Because at the end of the day, the health workers are the lifeblood of the healthcare system, and the infrastructural and equipment that we are providing have to be complemented by the health workers' welfare, and government is committed to finding ways to address those to the extent that we can within the resources available to us, and the President encouraged us to continue in that direction. Now, if there are additional questions, we're happy to pick them up later, and the Minister of Information can refer you to our ministry, and tomorrow we will also have discussions and we'll provide further information so that Nigerians are aware. We care, we're responding, we're leaning in, and we're trying to find resolutions, and we encourage the leaders of those unions to continue in that spirit. Thank you very much.